All right, we're live. We're live, team. So we'll just give it a little bit till I see some viewers starting to come online. But thank you both for joining me. I know it's hectic when you have kids. I've got 4 kids myself, so it's pretty busy, especially being in isolation.
Yep. Yes, very busy.
How many kids have you got, Monica?
I've got 4. I thought I'll have it all set. Like, they'll be watching a movie and relaxing by 8 o'clock. But yeah, not the case tonight.
Yeah, no, all good. We keep it real. This is what the everyday person's going through. Everyone watching will be understanding that. Hey, look, before we start, I think maybe we should open with a prayer. Pauline, if you could say a quick prayer for us, that'd be nice.
Thank you, brother. Our Heavenly Father, we're grateful for the time that we have to serve the community, to serve New Zealand, to use the skills that we have been given to respond to the COVID-19 illness that is affecting so many of our people in New Zealand, but also around the world. Please be with us tonight as we tell more with each other and learn more and share, that we may have your spirit to be with us, and we say these things in the name of Jesus Christ. Amen.
Amen. Awesome. Thank you both, Pauline and Monica, for joining me. I know it's you guys are both busy with families and work with what you're doing, but look, I really just want to just dive straight into this. But firstly, if we can just introduce yourselves, we'll start with Pauline.
Talofa, everyone. My name's Pauline. My day job is the nursing director for Alliance Health Plus Trust, which is one of the primary healthcare organisations in Auckland. But at the moment, I am the operations lead for the Pamura COVID-19 testing centre, and been involved in setting up the Otara site. At the moment, we're talking about other ways of providing services to the community. So thanks for having me, Dave. Thanks for the invitation, and thanks for having me.
Awesome. Monica?
Oh, kia ora. My name is Monica Liva. I'm a GP based out in Mangere, Turuki Healthcare. I've been a GP for the last 10 years. Love my job. From Mangere, and I have 4 kids. I've met Pauline through working at the COVID-19 community assessment, community-based assessment centres, and so pleasure working with you, Pauline. I'm learning as I go.
Awesome. Well, again, thank you both for joining me, and also want to thank Alliance Health Plus, who have been amazing, who we're now aligned with as our PHO. And I won't get into the politics of it all, but there's a lot of PHOs that talk a lot of rubbish. But it's Alliance is definitely not one of them. So thank you very much to Alliance Health Plus, Wayne Ulu. But I'll try not to be an activist tonight. Hey, look, the first thing I want to ask is, I think what most people want to know is, are you guys scared working out on the front line?
No, no, and that's because we have the personal protective equipment that we need, and we know what the infection control procedures and protocols are, and so the site that I run, I'm really strict on that because we need to protect our teams because they are facing suspected cases multiple times a day. So it's really important that our team is protected, and I won't make shortcuts when it comes to that. That's just me personally.
Monica?
Oh, so if you had asked me that question 2 weeks ago, I probably would have said yes. And to be honest, it is you can get quite anxious when you watch and news articles and especially on YouTube and around the world and what's happening. at the very start, I said a prayer and listened to our spiritual leader who said, don't let fear, COVID-19, the coronavirus drive fear into your heart. So just trying to be brave, and I appreciate all the infection control measures that are put in place at these, community-based centres. So yeah, have faith.
Awesome. Pauline, you were talking off air about that you actually went and you got the test.
Yes, I did. On Sunday, I went, and that was just mainly because I've been around it for about three weeks, and I mean, I wasn't really symptomatic, but I thought, I've been exposed to people that are positive, and I am a healthcare worker, which is part of the case definition. So I thought, I just wanted to check and actually to experience what it felt like to get a nose swab, and that was an experience, that's for sure. It's not the most comfortable test to have. It tickles at first, but because you have to get a good swab in there, it's kind of in your nose and like right at the back for a few seconds, and that's where the discomfort comes. And so when they finished, my eye was watering, I wanted to sneeze, and it took quite a few minutes to kind of feel a bit better. So I do feel for people that may not have a higher tolerance for discomfort, and definitely feel for our little ones. We have had some little ones come through needing swabs, and they just get really distressed, and I can definitely empathize with that now. And we had this one family. It was a dad, son and daughter. The kids were probably about 8 and 10. So the son, who was 8, he had his test, and he did really well. But the daughter, when she saw what the test was, she just totally refused. She's like, nah, I'm not having it done. So we're like, okay, no, that's fine. We can't force you. And we're just checking, dad and brother's results, and we just kind of take it from there. But not the most comfortable, but necessary. And the nose swabs have a higher efficacy, like the test is a little bit better than the throat swabs. The throat swabs are still okay, but the nose ones are the better ones. So it's just the type that you need to have.
We've got a question here. Maybe Monica, if you can answer this one, or we've got here, correct symptoms of COVID-19, as there are many mixed messages.
There are a lot of messages out there, and there are also some really good trusted websites that you can go to, like the COVID-19, the website, Ministry of Health, New Zealand, and also the CDC website, which is, so the main symptoms really from ranking are usually a fever, a cough, and generally this cough tends to be dry, from comments and opinions from experts, and shortness of breath seem to be the top 3. You can also have a mixture of like cold symptoms, head cold, and loss of smell. And there are some other symptoms that you can get, but those are usually the top few symptoms, well, the top 3: fever, cough, and shortness of breath.
So that's the hard thing, because a lot of those symptoms that you've gone through is like, if you had the flu or something like that. So how do you know if you should go and get tested if you have these symptoms, but you've been in isolation, you've been sticking to all the rules, but you've gotten sick like this? What do you do? Do you go to one of the testing stations, or you want to clarify that?
Me? Oh, shall I answer or you?
Yep.
Yeah, no, you go, Monica.
Okay. Yeah, so, a lot of people who do have those symptoms, they can be caused by lots of other viruses, and not necessarily COVID-19. However, there are some other factors that we have to take into consideration, like if you've recently traveled, come into contact with a probable case or confirmed COVID-19 case or suspected. That makes it more likely that we should test. However, with the new case criteria now, we can test based on respiratory symptoms alone, which is the fever, cough, and shortness of breath, and those other symptoms. Yeah.
Oh, awesome.
So you can call that. You can call the health line.
Yep.
Or your GP, or you can self-refer to those testing sites, because there'll be nurses and a doctor there that can assess and make those decisions for you.
So I think the first port of call for everyone listening and watching would be to call Healthline or their GP and then go from there, right?
Yep.
Yes, definitely.
Awesome.
Yep.
We got a question here, maybe Pauline, given this pandemic and how our Māori and PI communities have barriers in accessing healthcare with cultural and language barriers, what do you think needs to happen so we can improve access and resources?
That's a good question. I think there is some information out there. The translation of information has been a little bit slow, but hopefully that is improving now. They have a Pacific communications group that is that's been put together to be more responsive, because things are changing so quickly. Every 2 or 3 times a week something changes, and so to be able to respond to that, they've needed to kind of put a group together. But I think it's important to just make sure you're going to the sources of truth. So the sources of truth are the Ministry of Health website. They have the COVID website as well, and also the WHO website has some good resources as well, and does the whole global picture. Now, there has been some organisation around the Pacific workforce in terms of being available to provide information in the different languages. So at the moment, we're recruiting for Pacific nurses who speak the languages to be in the Auckland Regional Public Health Service. Now, that service does all the contact tracing. So if you're positive, then the Auckland Regional Public Health Service contacts that positive person and all their family and all the people that they've, been in contact with. And so, they're really looking for people that can speak the different Pacific languages. I know that there's also been, the Ministry of Pacific Peoples have been doing clips and providing resources as well. So we're getting a bit better, being responsive with the information in the different languages. And I think, though, one of the things that we do need to be mindful of the messaging is that, healthcare services are still available, and to not wait. If you're not well, you need to access services, whether that's your primary care services or hospital services. What the hospital has been seeing are people coming in quite sick because they didn't want to leave their house. So when you're unwell, that doesn't apply. You need to go and seek healthcare. So I think that's kind of been a little bit missed in the messaging a bit. It's been very strong, stay home, which is good, but that doesn't apply if you're sick. Because we don't want you to be very, very sick and then needing to go to hospital for, some time with complications. So yeah, please don't wait, still access health services.
Oh, yeah, amazing. Before we go on to the next question, I'll just ask our viewers if we can all hit the share button I think it's an important conversation for everyone to hear. The other question I had for you, Pauline, is some people are quite surprised at how little in terms of the cases for PI people. Is that because we're not getting tested, or what? I know a lot of the times we don't like going to the doctor or to get checks.
Yeah. Hi, baby. So a little bit of both. I think there haven't been large numbers of Pacific people getting tested. But that is going to that should improve now with the Otara site here.
Yeah.
For me, the jury's out on whether Pacific people have low incidence.
Yeah.
So we just need a test. We just need to keep testing to really understand how widespread it is in the Pacific community. So, I'm hopeful that the level 4 actions have minimised the impact for Pacific families.
Yeah.
So it's really just a wait and see. I think the next couple of weeks are going to be really key to for us to understand. I don't know Monica's view on that, but
So when did the Otara testing station start? This week, was it, or?
It started last Saturday.
Yeah.
So there's about 17 testing sites around Auckland now, and they've gone out in 3 phases. So last Saturday, Otara was part of the phase 3 rollout. The site that I manage in Pamua was phase 2, and so Takanini and Airport Oaks were phase 1 testing sites. So they're really the only ones in kind of South Auckland, aside from Pukekoi. There's one out there. I think there might be some geographical gaps, for Pacific people to access the testing centres. What we found in Otara was there were a large number of walk-ins, which we haven't really seen in the other centres. So I think that's a mixture of people that don't have cars and people that still like to have that face-to-face. So we had some people actually park their cars and then come and walk over.
Wow.
and we're like, oh, if you've got your car, if you could hop back in your car, just, drive through, that'd be great. But they're like, no, I'm okay. I'm happy to walk in. But, staying in your car is better protection for the workers, for the staff. But that's, if the community is kind of more comfortable, we just have to work with that. And so the way the process was flowing, we just had to modify to accommodate a higher number of walk-in people. I
just want to give a shout out as well to again Alliance Health Plus, and also Simon, my mate who set up the all the gear out there. Did he also do Pamua, or was it just Otara?
Just Otara,
Geez, that looks good out in Otara. That's really
Monica's worked out in Otara this week.
We got a question here, Monica. Maybe if you can answer this one. For many people not taking alert level 4 seriously, from your perspective on the front lines, what advice would you give them? Stay home.
Stay home. Keep to your bubble. By doing that, you're saving lives, just like what the government's saying. It's really important to understand that. You just have to look around at the news around the world and how it's affected countries such as Italy, Spain, and now New York is defined as a new epicenter. That can easily happen to our communities. Our Māori and Pacific people are very vulnerable, and it's really important to understand that the measures that have been put into place, such as staying home and keeping in your bubble, is very important to prevent numbers rising in our community.
Yeah.
There are some cases, but they're controlled at the moment. So we just like to keep it like that and then proceed to the elimination phase rather than trying to stamp out, a fire. So please listen.
We got a question from the audience for you, Monica. I have a question for Monica. I haven't. My elderly parents, they have asthma, and I wanted to see how do I go about getting a nebulizer for them. Can you read that?
Yeah. We have stopped them from going out, under control at the moment. I have contacted my GP. They said we all have to go into the clinic and see the doctor, but we are not allowing any of them to go out. So GP clinics are open. We're just consulting in a very different way, virtually, and we can do consultations over the phone and then make a plan. And if you do need to be seen and examined, they should advise you. They should have measures put in place to allow you to go into the clinic in an infection-controlled environment. So, not exposing you to others who may have coughs and colds. If your parents are well. So I would encourage you to talk to your clinic nurse and GP and find out the processes put in place at your clinic, your parents' clinic, and get advice on how you can get them seen. If they're well, they don't need to be seen. Your question specifically mentioned a nebulizer. There has been research and expert opinions from ED doctors, respiratory nurses that we work with, that the spacer and the inhaler is just as effective as the nebulizer. So you don't really need a nebulizer unless it's recommended by a specialist.
We spoke to Asthma New Zealand CEO last week, and we're speaking to her again tomorrow, Sunday. And she was saying that too, that the spacer with the inhaler is actually better than the nebulizer. So let's see. She's coming back Sunday, and we'll get in contact because they give out all those things for free. So we'll get in touch there.
It's not. It's a common question though. A lot of our Pacific Island or families, they love nebulizers because they get it at the hospital and they think it's instant relief, but the space is just as good.
Yeah. We've got another one. Got another one here. My dad is 83, mum is 74. They have not left the home. Can they go for a walk around the block? My dad is getting annoyed and frustrated. I think like all of us, should they both wear a face mask to go for a walk? They both very independent. Pauline?
Well, my mum is 73 and she goes for a walk every day. She's well. She knows to stay 2 meters away from anyone that she may come across. You don't really need to wear a mask, but a mask is comforting, being out in the big wide world if you are able to get hold of one. But definitely exercise is great, and continue to do that if you can.
This is from Marianne, one of our members. Are there enough testing kits?
Yes. We're well kitted out with swabs. We haven't heard that there is a shortage of swabs at the moment, and the testing centres have been well stocked for the long weekend. So no issues there.
This is a good question here because given the risk of contracting COVID-19 by the level of exposure you may have, how has that affected or impacted your family and home life situation? I mean, Monica, you've got 4 young kids. How's it affected you?
It has affected the way we go around our daily lives, such as going to work is normal, but coming home is my kids and to start off with, they weren't used to like, you know, being told to like go to the front of the house, because I'll enter through the back, which is closest to the shower, because I make sure that when I get home, I don't make any contact until I've had, you know, washed my, taken off all my clothes. Just going for a decontamination process, really. Just making sure. Yeah, soap kills the virus if it ever lands on me. So, you know, soapy shower, washing my clothes straight away, putting my shoes. Yeah. Sorry.
That's all good.
And over the weeks, I've noticed, actually, you know, I miss my kids running up to me straight away, you know. And so when I do come home, so this like last couple of days, this week, I've noticed they're just like, oh, hi, mom, you know, which is a bit sad. And I am cautious. I don't try to like kiss them too much, because just trying to keep them safe. But just open communication is important.
Yeah. Pauline, your kids are a bit older. How have you been finding it at your house?
All right. My kids don't really see much of me, really. But when I come home, I've got my own routine like Monica as well. And so the kids know my routine when I get home. Like, they just have to stay away from me until I've, you know, because I soak my clothes in a bucket of Dettol straight into the shower, and then I can, you know, touch the family and stuff. But yeah, I'm the same with Monica. I miss the hugs and just kind of like lying on the kids and you know, mucking around like that. Just you're just kind of a bit more cautious. And it is for their safety, you know, because you're the one that's taking the risks out of the home. And, you know, you're coming back into the bubble. So, you know, you're really wanting to try and protect the bubble. So you have to take, you know, those precautions. Yeah.
Yeah. Just in case I forget to say it at the end, thank you both on behalf of all of us, for you and all your team, for the work you guys are doing, and, you know, being on the front line and sacrificing so much.
Thank you.
Thank you. We got this one here. This is a good one. Any tips for mental health and wellness for our Pacifica and Māori families who may have 6 or more in their families, and even caring for their elderly parents who they look after as well? Mental health.
Yeah. I'll give that one to you, Monica.
Yeah. Oh, so mental health is a big one. Being cooped up at home can be hard. I guess it is a good time for people to try and connect with their family, you know, their kids, their loved ones, especially those who have parents or family members that are so busy working. It's important to utilize that time. Exercise is important. You know, it doesn't have to be strenuous. You can walk around the block. Just make sure it's close to home. You can go on YouTube, go on BBM.
Never mind YouTube. Just go straight to BBM. Don't worry about YouTube. Plenty of free workout.
Exercise is really important because it's a good coping strategy to help with stress, and it also helps boost your immune system. So, you know, exercise, eating well, and, you know, most of our Pacifica families very, you know, Christians. And so it's a good time to sit around and do family prayers.
Yeah, exactly right. And I think you go, Paul.
Oh, no, I was just going to say, you know, there's lots of projects around the home that, you know, you never quite get around to. And, you know, they can be good. That's good family time and being productive at the same time. So, yeah, I mean, I've got heaps of stuff I'd love to be doing around the house, but I think they'll still be there in the summertime. Yeah. So I think it's, you know, not just thinking a bit more laterally, you know, like instead of just the normal kind of stuff of what other things you can do, and you can tick a few boxes off at the same time.
Yeah. I think it's really important for our people, you know, that aren't on the front line and they're at home and they have all this extra time. I think it's really important that we start our health journeys. you know, because a lot of us, you know, as we're all aware, 73%, or almost 70%, sorry, almost 70% of PI adult obese, but children, I think, is 30%. You only got to walk around our deprived areas like South Auckland and some parts of West Auckland and realize it's far worse. So, you know, I think take this time right now to utilize. There's no takeaways. It's a lot harder to go to the dairy and to the supermarket if you want a peanut slab like I love, but it's a lot harder to do. So, you know, it's the environment's perfect to start your health journey. You know, I think don't just sit on the couch and be depressed about what we're in, because that stress is always going to be there. It's going to just be there. But at least if you start working on your health, both physical and mental, you can come out of this isolation, you know, in better shape instead of being in worse shape, you know.
Totally agree.
That's a good challenge, Dave, I think.
Yeah, I've set myself a little goal of trying to be able to touch my toes. I never stretch. Anyone who knows me knows I never stretch. I never warm up. I just have about 6 shots of coffee and then I train, and then I never cool down, and I complain I'm sore all the time. And I use this time to take up. Someone challenged me, actually, a lady called Nikki, who's a good friend of ours. She challenged me to be able to touch my toes by the time I come out of isolation. She knows I love a challenge. She sent me a video that was only 5 minutes because she knows that my attention span's not very long. So, and within 5 days I touched my toes. So I'm just continuing that on to get more and more flexible. Yeah, so that setting little goals, I think, is important, you know, to have a little goal that you can achieve coming out of isolation. And, you know, for some of our members, I mean, you guys, we run a program called From the Couch, who are more the people that just gathered up the courage to come into our headquarters and start their journeys. A lot of them have underlying health issues, so they're the most at risk with this COVID-19. But there's so many people like that are at home just watching what we're doing. And they've been in isolation for a long, long time, never mind this 4-week isolation. There's people out there, as you know, that have been in isolation for a long time. So my dream is, imagine this is what I'm trying to do. Because now we're impacting online, we're impacting hundreds of thousands of people now that would never have the access to us normally. Imagine if these people that are watching and joining in our From the Couch sessions online, by the time this isolation is finished, then they're actually out of isolation too, because I have enough courage to come in to start with us or to go to their local gym or community group and start. How amazing would that be, you know? So that's one of my goals as well, you know, so hopefully that happens. I've got another question here. What have we got here? It's a good one here. Can people who have recovered from COVID-19 get it again? And once they've recovered, can they still pass it on to others? Monica.
That's a difficult question, really, because, you know, this virus is new. A lot is unknown about it. I threw the question out to my peer group of fellow GPs, and apparently there's some anecdotal evidence that there has been a case where they've recovered and got it again, and in terms of whether they've recovered, can they still pass it to others? I'm not really sure, because it's a new virus. I'm not so sure. No, that's not so clear. Don't know. Sorry. So a lot of unknowns, really. There, you know, we know a lot about the measles, chickenpox. There are some cases who get chickenpox and you're supposed to be immune, but they get chickenpox again later in life. So I mean, there's a possibility. It's not 100% known.
Yeah. I guess you're right, because everything's new here, eh? So we won't really know.
Yeah, I mean, there's only been like comparisons to other coronavirus strains. So there's, you know, theories around how the virus will behave, but we just don't really know, to be honest.
Okay, we got there's a perception that COVID-19 affects those worse who are in health compromise and older. Do you know if the risk of death is just as high severe for younger age groups?
Mm.
Um,
Yeah, no, you go, Monica.
Well, what I've come across or read or heard is that there's not a lot of data to show the serious effects of in the younger age groups. However, from a medical or clinical approach, we are treating young children, babies, and pregnant women in the same category as those who have chronic conditions such as diabetes, heart, and asthma and COPD. We're treating them, grouping them together and treating them to be just as vulnerable. So, but I'm not too sure because of how new it is. I haven't heard of any stats with of the reports coming out from Italy. It's mainly the elderly people who are affected and those who have chronic conditions. So I haven't seen or heard or read anything in the younger age groups. So that's kind of reassuring, but we should all we're still being precautious, treating them the same.
Yeah, I think we all just have, it's just a blanket thing, we just all have to do what we're told and stay home.
Yes.
There's only a couple more questions here, and then I'll go and look in the comments. But this one here about the bubble. What happens if your bubble is about to burst? Are you able to relocate? What would be the procedure for creating another bubble? So, Pauline, I think what's happened here is you're being in isolation, and maybe you're getting over your current bubble.
Well, the short answer is no. So there is accommodation support if you have a positive COVID result, or I think probable, but I'm just trying to clarify that. But if it is, I mean, it's a little bit tricky, I guess, because Pacific families, we have a few bubbles that we would call our bubble. So if you go through the case definition where you haven't travelled, so if you have another bubble that you want to go to, well, everyone is meant to stay where they are. You could just do your own assessment and, have any of the bubbles travelled? Have any of the bubbles been in contact, with positive people, probable or suspected? Any of your bubbles, do they have healthcare workers? And do any of the bubbles have symptoms? So if it's no to all of those, the chances are, and correct me if I'm wrong, Monica, are quite low. So you could go to another bubble, but you'd need to be asking those kinds of questions, just to keep, the bubble safe, you and everyone in those bubbles. Yeah,
I reckon that we really need to be careful here, because if you're just getting annoyed, as we all do, with your current bubble, maybe you just need to go find a chill out zone and join me on a stretching session or something. We need to be careful. There's a lot at stake here, So
I'd be drawing the hard line and saying no, stick to your bubble.
Yeah.
There are some scenarios though when if you feel unsafe in your bubble, if there's violence in the household, there is help out there that you can access, such as Women's Refuge. If you're not sure, call the Healthline or your GP. In those type of scenarios.
Because I spoke to someone today actually that this was happening. It was to a family member. There was some violence in the household. Now the thing is that this isolation can bring in the worst. If there was issues going in to isolation, they're definitely going to come out while in isolation. So I think they were going through the process of relocating.
Yeah.
But I think, like you said, to be sure if that's happening, I think you'd have to call Healthline. Is that the first port of call, or is there somewhere else that we'd go to, or
For relocation?
yeah, if that's happening, if there's violence in the house?
Uh,
I guess if you feel immediately threatened, call the police.
Yeah.
And then
So that would be the first side.
Yeah.
For some advice, yeah.
Yeah, and I think to our listeners, I think that's really important, because maybe the people, they might be shy and they don't want to cause a fuss, but you're not causing a fuss. If you're in danger and there's violence in the household, call the police immediately, and they'll go through the right procedures. I think that's really important to get that out there. Don't stay, because we're in isolation. So
it's a similar scenario of, not feeling well and needing to access health services. All of those services are still there and available for you.
Yeah.
So don't feel that, you can't reach out and access them.
Yeah. This is from my uncle. How long does it take to be tested using the drive-through?
The actual test or the sample going to the lab?
I think the actual test. Coming through the drive-through, not the drive-through at KFC, the drive-through at the testing station.
It depends on how many people are waiting. Sometimes it can take, 30 minutes of waiting, over 30 minutes, or it can take like 10 minutes. It could be 30 to 40 minutes. And then the actual test itself is only about 10 seconds.
Oh, wow.
Yeah, about 10 seconds. But the process is they need to, you have a triage to understand your symptoms, and your travel history, contact history, etc. And then we need to find you in the health system. So to find your NHI number, so that when the sample's taken, it's labeled correctly with your details. So when it goes to the lab, they can process it. So that's why it takes, there's a few steps to it. But then the actual test is only a few seconds. And then the results are back between 48 hours and 5 days. So 2 to 5 days, we say. Yeah. If it's a positive, you will get notified immediately, but about 2 to 5 days. And during that time, you are meant to be more strict in your self-isolation within your bubble, just until your results come back, just to be on the safe side.
Yeah, and I think, if people are willing to wait in line for hours at a liquor store out here, I'm sure they can, take the time. We had a good question here, Monica. We live in Papakura. My mum's GP is in Otara. If she does require a COVID-19 test at some time, she will want a Samoan-speaking practitioner. Can I bring it to Otara testing station instead of Papakura one?
Yes, my understanding is that you can travel to any testing site. I also understand that you can request for an interpreter, and I guess the benefit with Otara is there are interpreters on site. A lot of the staff speak Samoan. However, you can access an interpreter, and but I haven't had to. Is that maybe Pauline would know? Because there should be a translating service available, via the telephone.
Yeah, we haven't had to. We've been fortunate to have staff that speak different languages, Pacific languages. So you can go to any of the testing stations. It doesn't matter. You can choose which one you go to, anywhere across Auckland.
Okay.
And it doesn't cost anything if that comes through.
Yeah.
Yeah.
We got one here. So this is all coming live through these questions. Is the travel history still a requirement to get tested?
No, it's symptoms. Symptoms is the main criteria now. Just if you have a travel history, it just increases your risk of probability.
So really, what you're saying, if you got those symptoms, ring up Healthline, and then they'll let you know what to do, or you can self-refer, like you're saying, right?
Yes,
correct.
And Uncle asked a question here. Why a drive-through and not walk-in?
Drive-through is to protect the staff from exposure. But people, I think most of the testing centres will accept you if you walk in.
Yeah.
But it's safer for the staff if people are driving through.
Yeah.
And also it's safer for the patient too, because the staff have a risk that we can pass on to the patient. So we are
true,
to each other. So we want to minimize that risk.
Yeah.
Awesome. Oh, we're nearly there. We're nearly pumped through these questions, which is good. Why do some people pass virus and not get sick and others get sick?
Yeah, that's a difficult question. I again threw this out to my peer group of GPs, and the feedback was and the opinion was that people have different immune systems.
Yeah.
Some will have a immune system that will will recognize it, won't produce any symptoms, and then there are others who will have a probably different, maybe weaker immune system, who will get symptoms and be very sick or be in the middle.
Just one question for me. Do you think that this isolation level 4, do you think it'll be over in 4 weeks, or are you thinking that it'll be more?
I don't know.
Yeah, I'm
maybe longer.
It could go either way. It depends on how well behaved we've been these past 2 weeks, and also how far the virus has transmitted, through the community, as well as our essential workers, our essential working bubbles.
Yeah.
And that data will come through this week, and hopefully we'll have a clearer answer by next week. But I think people should have some understanding and flexibility around the possibility that the lockdown could go further, and we have to rely on our leaders and the expert advice that they're getting. We don't know the whole situation. I think we should be a bit flexible to that.
I'm thinking it's going to be longer. I think we're going to be in level 4 for longer, I think.
Like what Monica said, the data really guides a lot of decisions, and the expert advice from the lessons learned overseas, as well as the epidemiologists, who understand patterns of disease. So I think if we just stick to the rules, stay home, stay in your bubble, unless you have to leave for a good reason, we will get to that point faster. But like our Prime Minister has said, that won't be a decision that is rushed, because it's the health of our population, health of our New Zealanders that is really of the most importance. She won't bring that down quickly. It'll be a very considered decision to change.
We just have to be patient with it, because it's it's worth it. We have to be. And what I'm worried about, now that a lot of our people are starting to get tested now, I'm worried there's going to be an influx of us, that have got COVID. So I guess so all these people we started Otara last week, or was it Saturday? Then when they start getting it, we start seeing all these tests coming back. So that's what I'm worried about. And then, then this makes things push out longer, Is that what happens, or? And overall, we've got a few clusters in New Zealand. So the community transmission is just a little bit that's been observed, not like widespread. Because if it's widespread community transmission, that's quite difficult to contain. But we're not
at that point right now, but there are a lot of clusters. So, understanding how big those clusters are and containing those clusters is really going to help with that. But, the way we do that is just stay home.
Yeah.
Stay home in your bubble and, minimize minimize contact with people. And really, that 2 meters, just, keep that distance from people you don't know or people that you aren't mixing with at home. Very important, just because of the way the virus is transmitted. So
I got this question here, and it's one I've been asked by a few people actually. I've just got I put last questions out, so they're starting to roll in now. But is the virus connected to 5G or is just a conspiracy theory?
I've been reading a bit about that lately. It's been going around quite a bit, and it's been like MERS and SARS have been linked to the previous rollouts of 4G and that. So, I watched something this morning, which had a lawyer talking in the US Senate about 5G and the effects of 5G producing cancers and things. I'm not sure. I don't know enough to be able to say yes or no. But the information's out there, and I'd say just learn about it and decide for yourself. Yeah.
Yeah, I've heard a lot of things about 5G as well. A long time before this, actually, I met a TV personality, and that person was talking about it. And there's a lot at play here that we don't know about, And I was talking to this person. I won't say who it was, but they were trying to bring it up and do it on the show, and it just got shut down, because there's a lot of. Thing is, there's a lot of money.
Yeah.
And so I wouldn't put it past it, but I know 5G is no good. But there's of serious money.
Yeah. So I mean, there's lots of information out there. So you can make that decision on where you sit in relation to that. Yeah.
All right, we've got a few more questions here. Oh, you go, sorry, Monica.
Oh no, sorry. I was just going to say I don't know enough about that to make a comment. So I apologize.
Yeah, I just think there's, just with the people I've spoken to, when they've tried to bring it up in their work to try and do stuff, stories about it, it will just shut down because there's so much money, and anytime there's something like money is involved and people can lose a lot of it. Something dodgy is going on, so I think we've got to do our research, do education about it, and understand that the power of the people still exists.
Correct.
So, we've got to come together on it. And once all the research comes out, let's get through this first, and then I'm sure, if the people come together, we can overrule.
Yeah. I think one of the things that the 5G debate can do is to really reflect on how much you use technology, how often you use technology, and how much like the Wi-Fi is on, because that's waves in the air that you don't physically feel, but have effects just because of what it is. So I think in that respect, reflecting on how much you're connected to your phone and connected to your devices, and how reliant you are on the internet, etc. Is a good thing, so yeah.
Well, I don't know if we need 5G, if this is pretty good now, so I think 5G is for like when you to have driverless cars and things like that. It needs
That's
to
right.
be,
Yeah. Well, when I started reading about that, I was like, man, I better check my phone and see if that's a 5G. No, it's a 4G. So I was like, okay, that's a slightly better.
We got another question here. If you're isolating and your sisters are isolating, is it okay to just go between two houses? Again, that's really a no, really, isn't it?
Yeah.
Yes.
It is
No,
really a
I'd
no.
say no. Yeah.
We just got to stay
Purely
with
because
it.
you're breaking the bubble.
Yeah, we just got to stay with it. We all do our part. Here's another one here. We're nearly there. Do you think the numbers will change with the cooler months coming up and the PM still letting people back into the country, and a lot of them are testing positive?
Do you want to answer that, Monica? Or you want me to?
Monica's just left. She must have
Just-
pressed the button. She'll come back.
So there are two things there. One, the cooler months, and then the second one is travel. Yes to both, actually. The cooler months are the natural home for viruses to start going around. So it's flu season. So, flu vaccines have already been given, and very mindful of our older people and those with conditions. So in Europe, they've been having their winter right now.
Yeah.
And so that's why I think it has been hitting them a bit harder, because they are in winter. So it will be interesting to see how our winter goes, only because we have put in place some actions to minimize the spread of the virus. So again, because it's a new virus, we don't know how it will behave in the cooler months, but there is an expectation that the numbers will go up, but we don't know. And then in terms of travel, that's a definite yes, because a lot of our cases, even though it's reducing now, have been directly related to travel.
Yeah.
So travel is going to be a very important one. And so I think the Prime Minister is going to be very cautious about opening the borders in any shape or form because of that fact.
Yeah, I think it's going to be a long time before the borders are open again. Not even just ours, world, it's just going to be a long time before that happens, for good reason. Look, we'll finish on this question here. Marianne, got this one here. It's mine and all deceased are now being COVID tested. Is this true also that the bodies are going to coroners for autopsies, which for some of us Māori we don't authorise, especially when or if we know the person has died from existing medical conditions?
As far as I know, no. I haven't heard of that at all, actually. So the second part about bodies going to coroners for autopsy. Autopsy is usually performed when it's an unexplained or unexpected death. And if you are not happy with an autopsy to be performed, you can refuse that unless it's in a criminal case. That's just my understanding, but I'm not an expert in that area, but that's my understanding. Yeah.
Oh well, look, we've been going now for bang on an hour, so we might wrap it up there. But I just want to really thank you, Pauline, and also Monica, for for agreeing to come on. And I might get if you can text me Monica's number so I can text her to say thank you very much.
Yeah, sure thing. Yeah. Pass it on. Yeah.
And it was having the 4 young kids, so we really appreciate both of your time. But sis, if you could please close us with a prayer, and then we'll give our no excuses, and then we're off.
Well, thanks for having me, brother, and hopefully that's helped understand a little bit more around the response to COVID-19 and provided some tips for people. So it was pretty cool. So thank you. All right, let us pray. Our Father in heaven, we are so grateful for the time that we have spent together talking about the virus that has impacted the world so greatly. We're grateful for your love and your spirit that continues to guide us and helps us with ourselves and within our families. Please be with us as we journey through this challenging time, that we do so with love and peace in our hearts, and please bless those that need your support, and for those that are supporting others. And we say these things in the name of Jesus Christ. Amen.
Amen. Hey, thank you so much, sis, man. I really appreciate it. Thank you on you and Monica, Alliance South Plus, Wayne Ulu. Thank you, all the team, on behalf of all of us, for the work you're doing and the sacrifices you're making. God bless you. It was awesome.
Thank you. Appreciate it.
Yeah. No excuses. Throw the X's up. Thank you, team. See you later.